And they always believed post-surgery they will have a complication. Here in our Institute of Neurosciences and Spine Care at Whitefield, we have surgeons with high skill with more than 35 years of experience, and they've done more than 40,000 surgeries.
At Aster International Institute of Neurosciences Whitefield, we believe that harnessing the best use of technology delivers the ideal and the best outcomes. So, take for example the case of a lady who was brought to us from Mysore about 2 weeks ago with a bleed in the brain. So we took her to the cath lab as an emergency. At this institute, we have a biplane hybrid cath lab where the resolution is in high definition. We were able to localize that the source of the bleeding was a broad-necked PCOM aneurysm.
Our guests of honor, Rotarian Satish Madhavan and Rotarian Jagdish Gokavarapu, and our esteemed medical fraternity, friends, guests, and Asterians. It gives me great pleasure to be standing here today in front of all of you, representing Aster's India growth journey. From a single clinic in Dubai in 1987, Dr. Azad Mubin, our beloved chairman, has built this organization into a global healthcare conglomerate in 5 states, providing care across primary, secondary, tertiary, and quaternary care. With 19 hospitals and over 200 pharmacies and labs each, Aster's growth in India is only gathering more steam. Today, Aster Hospital stands as a trusted name in the Indian healthcare landscape, recognized not only in the nation, but on the world stage. This success is a testament to the dedication of our doctors, our nurses, our paramedics, and each and every staff of Aster who has worked tirelessly to make Aster what it is today. Among our world-class facilities stands Aster Whitefield, today's star. Our 3rd multi-specialty hospital in Bangalore, which stands as a top-tier medical institution in the city, with a strong focus on delivering world-class, patient-centric environment.
Especially to our guest, Dr. Narayan Murthy, whom we very popularly call him as NRM. And today's event, as you all know, it's a sort of formally ushering on the Department of Neurosciences at the Aster International Institute of Neurosciences at Whitefield. And also, you know, it is the unveiling of the EPIC program, which you will hear more about from Dr. Satish, whose brainchild this was a couple of years ago, and we are continuing this now. And these are the top-notch facilities in the center, which our chairman was very kind enough to approve, and this is going to benefit all our patients in the city, in the state, and the country, so they need not be looking for these facilities abroad.
So first of all, I'll thank you, all the people who have come here for this wonderful program. And this program is purely, as my partner said, Swaroop, is for the 2 reasons. One is, the first and foremost, is the public-oriented, closer to our heart, a new program, and it's not a new program to me, but new program to the institution, which I want to spread to every institute so that we are closer as a human being and the doctors. Our main aim is to serve the society, irrespective of who the patient is, where they come from, and what economic state they come in. With that background, we always start in our department, any new program, we can post about our surgeries, but we always think the things which are closer to the society, we have to always introduce to everyone rather than what we are biggest at. So in that way, we started this EPIC program. And I should thank Narayan Murthy sir for having come here to bless us, along with the Rotary International Head, Mr. Flight Lieutenant Nagesh. Without me knowing, he just arrived here because he got to know we are doing this program.
Friends, Rotary has 7 areas of focus focus, one of which is disease prevention and treatment. This project falls exactly where we want it to be. Rotary International believes that it has to create a greater impact in this world, and we spend about $200 million every year doing global grants across the world.
Have been more and more dazed, more and more humble, because Professor Satish Rudrapa and Professor Swarup Gopal and their team took me and my colleague Sri M.D. Ranganath through their technology laboratories, showing how they are using technology for the benefit of neurological patients. I've also learned something, and that is an intelligent man knows what to say and when, but a wise man knows whether to say it. Therefore, in the presence of experts like Satish, Swarup and others, I think it's better that I keep whatever little I want to say to an absolute minimum and leave this place unscathed.
Not acceptable.
Well, Professor Satish Rudrapa, Dr. Mupen, Professor Swarup Gopal, Sri Satish Madhavan, and Sri Nagesh.
Is Compassion Unlimited with a lot of action with latest technology. I never heard. There is a corporate giant says we are ready to work for 80 hours per week to earn more, to donate more. And yes, and we Rotarians are ready to serve the community with a commitment of 24/7 anywhere across the globe.
Besides that, what we are most proud of perhaps is our collaboration with Rotary International to launch the EPIC program, the Epilepsy Prevention and Integrated Care Program. Aster's mission has always been the marriage of excellence with service. And today, with the inauguration of our neurosciences department and the launch of the EPIC program, this is a great marriage in our mission of serving the community and providing accessible, affordable, and quality healthcare to all. We're very proud, we're very excited to see where the EPIC program can go. We have big aspirations for it. We really want to help this underserved community. Epilepsy is a stigmatized disease, unfortunately. A lot of people suffer in silence, families suffer in silence. It is our onus and responsibility to help these people, give them a voice and give them a solution. We're very excited about this project. Aster is growing tremendously in India, and we want to take on more and more initiatives of this sort to really help the community. Thank you.
We have joined Aster about 8 months ago, and we have completed about 700 surgeries. As you have seen today, all the equipment that we have at Aster Whitefield is on display in the corridor outside. It is state of the art. Some of the equipment is the first in Asia, first in Southeast Asia, and we are very proud to offer these equipments to our patients at a very, very affordable cost. So in reality, we have brought the Western level of healthcare to the benefit of people in Bangalore, in the state, as well as the country, and we hope to extend these facilities to our neighbors as well, neighboring states, and also in Africa and other parts of the continent.
Today, on a wonderful day, an auspicious day in the world, at the Aster Whitefield, in association with the Supriya NGO and the Rotary International and Rotary IT Corridor, we are starting a new program called as EPIC program. So, the EPIC program is nothing but epilepsy prevention and integrated care program. In this program, we are doing a public awareness program on epilepsy because epilepsy is a stigmatized one. Many epilepsy patients do not tell what exactly they have. So especially in the rural area, it has become a taboo so that people do not come out, they don't go to school, they don't marry, they have a difficulty in communicating with the doctors, and families sometimes abandon them. To increase this awareness, we have come out with this epilepsy program, and those patients whose epilepsy is not controlled, that means they get more than 2 to 3 episodes per week. We have a program where we do free MRI, free video EEG, and diagnose where it is coming from the brain. And there is a brain surgery available as of today, where if you find out the focus from where epilepsy is starting, we can take out that part of the brain and patient do as good as normal person. And many of them can come out of the medication. And this is, is done free of cost to all the below poverty line patients in Aster Whitefield, Department of Neurosciences in Whitefield. Please avail this. There is an app available called as Epic-Rotary, which is available both in Kannada and English. And we have a hotline number. Please visit our website, Aster Whitefield Hospital, and you will find the helpline number. Any epileptic anywhere in the country need our help. We are always available. And this is a great program for society. Please do not differentiate epilepsy patients. They are as normal as anybody. And any one of us can get epilepsy, whether children, adult, depending on the age, or anybody who has a good brain. It is just an electrical activity which happens momentarily and spreads to the rest of the brain. It is not a disease, it is a kind of a symptom. If it is diagnosed early, 90% of patients can be cured. And those who have a difficulty, please come to us. We are always there to help you and to tell you how to get treated, how to avoid it, and if you still have it, how I can make sure with a brain surgery and epilepsy surgery, we can make you much more better.